Can't hear you. Please make unmute.
Hello. Hello. No problem. শুনছে না কেউ যে?
Sir, we're listen. We can hear you, sir.
Hello.
Sir, we can hear you, sir.
All right. All right. Thank you.
So, Mr. Habib, you can hear me. I am hearing you.
You are clear.
So, but there is no video. Your video is stopped saying like this.
No.
Then it is a technical fault from my mobile maybe.
Technical error might be.
I'll try that.
Sir, host can ask Mr. Mukhlis Rahman to share his camera. Host can ask him.
Yeah, I request to add me in your camera so that
When you log in, the option in your phone, when you log in, it happens there. So I again request you to log off and just log in again. That
okay,
would, I'm not expert actually in this.
it's okay.
But my expert team, I can consult them how they can help you really too.
Is there anybody?
Rahan, are you?
Professor Rahman, sir, could you hear me?
Yeah, I'm clearly hearing
Sir,
you.
sir, you can leave the meeting
We already
just
make
for
you
a while.
co-host, then you
You
can
can join
share
again.
your screen.
Then
So we are already in and 14 minutes after the schedule. Honorable Session Chair, are you here, sir?
Yeah, I'm here.
All right. I really beg your pardon to make all of late for a few minutes. People are confused at a time with the same device. Two sessions are on, and another two serious matter is, as we have few more sessions today, all the speakers are communicating through the same device. I cannot connect still. I'm just using laptop, but it's mobile phone. My messages are already blocked. I cannot send even message. So I'm just trying to communicate people with email and WhatsApp sometime. So good morning to all of you. We're very delighted to announce for the third day of our fourth international conference on strengthening social solidarity, community resilience, global connectedness. You know, it starts on 3rd of April and will be on up to 6th of April, I mean tomorrow. Already many sessions over. It was a grand opening, and this is for the third day. And this is technical session 8. We are very honored to have our honorable session chair, Dr. Nasiruddin Mithul, Honorable Dean, School of Undergraduate, National University of Bangladesh. We have had our honorable discussant, Dr. Poonam Gulalia. Actually, Dr. Dimpi Mahanta was supposed to be here. I draw your kind attention, honorable session chair. Dr. Poonam Gulalia from TISS, Tata Institute of Social Science. She is joining us as honorable discussant, and session guest, Mr. Mukhlis Rahman, ex-secretary, Government of Bangladesh, and Mr. Mukuljyoti Chakma. Actually, Mr. Mukuljyoti did apology to us because of his family affairs. Now he's in hospital. So already we requested Professor Ali Okkar Suhel from Shahjalal University of Science and Technology. He will join very soon, I hope. And there are 10 presenter, Mary Grace Paris from Philippines, Dr. Kem Rizal Purim, Lutfur Rahman Manik, Rakil Khandukar, Ariful Haq Sharkar, Salman Suhel. So, honorable session chair, you can start. Gradually, they will come in. I do believe they will join soon. Thank you.
Thank you. Thank you very much, Mr. Habib. And I know you are doing very well. And from last 2 days to tomorrow, you are overcrowded. I think you are completely overcrowded with the bulk of presentation. I welcome all of the guest presenters in this session. Already Mr. Habib introduced me and the presenters. So we have 10 presentations in this session. and you all are concerned about the theme, that is increasing trends of drug addiction, academic frustration, social awareness, and education during pandemic, and community leadership. It's a very common phenomenon during this pandemic, I think. So here, the 10 presenters will present their paper, and without any explanation and description, I would like to welcome the first presenter. But before starting here, one announcement that yes, we have 10 presentation. So each of you will get 10 minutes time for your presentation. We already have 5 to 10 minutes delay. That's why I'm requesting all of you to complete your presentation within 10 minutes, please. And then I think discussant and the session speakers will say something on your questions and answers. So first of all, I would like to welcome first presenter. Let me see, the name of the first presenter is Mary Grace Fairs from Philippines. Are you there? Can you listen me, please? And you are going to present your paper on a multiple embodied case study on drug addiction, relapse among selected recovering drug dependents in Davao City, Philippines. So we will
Yes.
learn from you about the context of the Philippines regarding drug addiction. You are welcome. Thank you very much.
Okay, good afternoon. Thank you, sir. So I will now present my, okay. Can I present my PowerPoint now? The host disabled.
Yeah,
I think
Now
Okay.
you can share your
yeah,
presentation.
yes. Okay,
fine.
it's okay now. Can you see my presentations?
It's coming. Yeah. Yeah, we can see it right now clearly.
All right, thank you. So, wait. Oops. Let me, sorry. Wait. I'm still, oh, my presentation is gone. Wait. Sorry. Okay.
You try quickly.
Yes.
Don't worry.
I'm sorry. Okay, can you see my presentation now?
It's coming. Yeah, it's okay right now.
Okay. And then, wait. Okay. So, okay. Okay, good afternoon, everyone. Sorry for the delay. So first of all, I want to express my sincerest gratitude to the organizers, especially to Professor Habibur Rahman for giving me this opportunity to present my study entitled Drug Addiction Relapse Among Selected Recovering Drug Dependents in Davao City, Philippines, a multiple embedded case study. So this study was conducted last 2019, just a year before the pandemic. Okay, so I will start my presentation by defining what is substance use disorder. So substance use disorder occurs when the recurrent use of alcohol and or drugs causes clinically and functionally significant impairment, such as health problems, disability, and failure to meet major responsibilities at work, school, or at home. So in the 2015 nationwide survey on the nature and extent of drug abuse in the Philippines conducted by the Dangerous Drugs Board, there are 1.8 of the total population who use prohibited drugs. So 1.8 million individuals. So in order to respond to this problem, there are some interventions employed specifically to help those individuals who suffer from substance use disorder, such as admission to facilities for treatment and rehabilitation, and of course, family therapy. The latter part of the rehabilitation process includes preparing them for their reintegration with their family and communities. However, documentation of cases of readmission by the Dangerous Drugs Board revealed that there's an increase of almost 40% on readmission from 2013 to 2016. So as we can see, no, there's a significant increase in the number of recovering drug dependents who returned to drug use and was assessed in need of readmission to rehabilitation facilities. However, this data does not include those recovering drug dependents who experienced relapse but was not sent back to the rehabilitation facilities. So these episodes of returning back to drug use is commonly termed as relapse, or the resumption of resumption of substance use after a period of abstinence. It is a frustrating, but frequent part of the rehabilitation process, because according to the Journal of the American Medical Association, there are up to 60% of patients who receive substance abuse treatment will relapse within 1 year. So this is because substance abuse disorder is known to us as a chronic relapsing brain disease, because it affects the brain, its structure, and how it works. So therefore, there is a high possibility for a recovering drug dependent to experience relapse despite the interventions he or she received while in the rehabilitation facility. And relapse can be a part of the recovery process. But though it can be a part, or it can occur, it can be prevented as suggested in the relapse prevention model by Marlatt and Gordon. Unfortunately, there's a lack of studies in relation to drug addiction relapse here in the Philippines. With the increasing number of readmissions, there's a necessity to look into the contributing factors of drug addiction relapse in order to prevent the recurrence of the addictive behavior. So this study focused on the following. One, experiences of the recovering drug dependents, their family and significant others on drug addiction relapse. And then the study also looked into the factors that contributed to the condition. And lastly, the coping mechanisms in dealing and are preventing drug addiction relapse. So for the theoretical framework, this study is anchored in the relapse prevention model by Marlatt and Gordon, which was originally developed to explain relapse among alcoholics. So at present, it is used to have a better understanding on drug addiction relapse. So in using the aforementioned model, the intervention were aimed at increasing awareness of the possibility of even the likelihood of lapse and relapse, and awareness of self. So this model also emphasizes that relapse is a process that could be identified and resisted. And it focuses on the identifying coping skills and supporting lifestyle balance in the lives of the recovering drug dependents. So the study answered the following questions. One, the profile of the recovering drug dependents, or we call them RDDs. And second, it answered how have the recovering drug dependents experienced the following: rehabilitation, reintegration, and relapse. And how did they manage their relapse episodes? And what are the support mechanisms available to the recovering drug dependents? And lastly, what can they suggest? What can they suggest to prevent drug addiction relapse? For the methodology, the design of the study was descriptive, utilizing a qualitative approach, and it employed a case study method, particularly the multiple embedded case study design, because it sought to understand intensively the experiences of the recovering drug dependents, specifically on drug addiction relapse, and of course, also the experience of their family and significant others. And the locale of the study is here in Davao City, Philippines. Okay.
Excuse me, I'm requesting all of the participants here to mute your microphone, please. Yeah, speaker, proceed on, please.
Okay, thank you. Okay, for the unit of analysis, so we have here recovering drug dependents who completed the treatment and rehabilitation in a drug rehabilitation facility. And during the interview, during the data gathering, they have presently or has completed submitting themselves to aftercare services. And of course, no, they have the respondents experience episodes of drug addiction relapse. For the family members and recovery body, I have interviewed one recovery body. They have the personal knowledge about the relapse episode of their RDD, of the recovering drug dependent. Okay, so for the sampling, no, the respondents was chosen purposively, and the identification of the respondents was through a gatekeeper. Okay, for the findings, for the rehabilitation, reintegration, aftercare, relapse experiences, so all three RDD respondents have completed treatment in a rehabilitation center in Davao City. So they have undergone activities such as individual and group sessions, structured activities, sports and recreational activities. They have also undergone family interventions such as family dialogue and family therapy, and they have also submitted themselves for aftercare intervention. So here in the Philippines, here in Davao City, after recovery, a person undergone a 6 months intensive rehab, he or she needs to submit himself or herself for another 18 months of aftercare service. Okay. So for our three RDD respondents, our first respondent, he relapsed while on aftercare, and because of this, he extended his aftercare for another 18 months. Our second case, he was readmitted for treatment for 4 times due to relapse, and our third case, he relapsed while on aftercare and has decided to manage his relapse episode on his own. Okay, so our RDD respondents encounter different internal and external triggering factors to relapse. So I categorize it into two, the internal and external factors. So for the internal factors, the respondent identified these triggering factors like thoughts about drug use, inability to express feelings which resulted in keeping it to self, lack of appropriate coping mechanisms, and boredom. For the external factors, they identified problems in the family, reassociation with drug-using friends, unconducive environment, failed relationships, and tainted interpersonal relationships.
Dear speaker, you have only 2 minutes in hand, please.
Okay. So with regards to managing relapse, so the respondents utilized some relapse prevention techniques like maintaining balanced lifestyle, avoiding euphoric recall, avoiding vices such as smoking and drinking, avoiding reassociation with friends who are still using drugs, living life one day at a time to avoid disappointments and frustration, and eating chocolates. No one respondent identified this one. So they also maximize the recovery capital, such for the personal recovery capital, like a strong sense of determination to stop, application of learnings, motivation to help other RDD, and commitment to do lifetime service work, and of course, their employment and income. For the social capital, they identified their families and self-help group as their recovery capital. Okay. And for the support mechanisms, all respondents receive support from their family, their sober friends, and self-help support group. Okay, so these are the suggestions and recommendations they identified in order to prevent relapse, like the application of the TC philosophy and follow the serenity prayer, which is being taught by the NANS, Narcotics Anonymous and Alcoholic Anonymous groups, okay, or meetings. Structured activities and maintenance of balanced lifestyle, avoiding physical environmental triggers and reassociation with drug using peers, enhancing spirituality, provision of family support, removal of stigma in the community, provision of continuous programs and services for recovering drug dependence. And for the implication of the study, okay, so this study implies that not all cases of relapse are being monitored here in Davao City. So therefore, there's a need to install mechanisms to monitor relapse cases. And based on responses, it was found out that most relapse episodes happen while the respondents are on aftercare. And also there's a need to strengthen family reintegration preparations because we have cases that they relapse because of lack of family preparation. And then there's a need to support from the family and several friends in sustaining recovery. So it is therefore worth
skip some
considering.
slides I'm requesting you. And
yes. I only have 2 slides remaining. Okay. So this study also implies that drug addiction is indeed a family disease. So it is therefore beneficial if there's provision of intervention to family members and significant others, okay, that it would be institutionalized and make it part of the intervention. And the study also implies that the stigma is still prevalent among the recovering drug dependents, and this affects the help-seeking behavior of other help-seeking behavior. So therefore, there's a need to assess the existing advocacy initiative concerning the welfare of RDDs. And lastly, my last slide, there are different indigenous strategies being utilized by recovering drug dependence, like eating chocolate. So I think it's good to also look into this indigenous strategies, and there's a need to include the matter of drug addiction relapse in addressing the drug problem. Okay, that's all, and thank you.
Thank you very much for your nice presentation, Mary Grace. You explained about the relapse methods of the drug addicted people in Philippines. We all are benefited by this. Now I would like to welcome our second presenter, Dr. K.M. Rezaul Karim, Associate Professor, Department of Sociology, Government MM College, Joshore, Bangladesh. So his the topic is assessing the drug addiction of drug users under treatment, Bangladesh perspective. So Mr. Rezaul Karim, I would like to welcome you, but before your presentation, I'm requesting all of you to mute your microphone for clear listening to everybody. Thank you very much. Mr. Reza, you are welcome to present your paper. Can you listen me, Mr. Reza? Hello, our second
Honorable Session Chair, Dr. Reza actually couldn't join because of technical problem. He couldn't join, right?
Okay, as long as he could
might come later if it's possible. So it is a request so far. Elizabeth Alexandra here. Alexandra, can you hear me?
Elizabeth Alexandra?
Yes, sir, I can hear you.
Yeah.
So Elizabeth is here, Abu Raihan is here, Ariful Haq Sharkar is here, Rakhil is here. So you can actually reshuffle them.
Yeah, we can. I'm going through the sequence of the program as you have sent to me. So next, after Rezaul Karim, as he is absent right now, I am welcome Lutfur Rahman Manik. Mr. Lutfur Rahman Manik is here. If he is not here, then I am welcoming Rakhil Khandokar. Rakhil Khandokar, are you here? If not, then Mohammad Ariful Haq Sarkar. Please respond. Mr. Ariful Haq Sarkar. I think Mr. Habib will say Ariful Haq has already joined. So if he joined, then he should present his paper. Mr. Ariful Haq Sarkar.
We can directly go to Abu Raihan. Arif is joining just now. He knocked me. He is coming. So we can go to Abu Raihan, sir.
Okay. Let's go to the Abu Raihan. Our number 7 presenter, Abu Raihan, assistant project officer, work for a better Bangladesh.
Sir, can you hear me, sir?
Yeah, we can hear you. Please, you just go through on your presentation and present your paper. Okay.
Okay, sir. Thank you, sir. Thank you so much to invite me. Honorable guest and everyone, good morning. I'm Abu Raihan, working at Work for a Better Bangladesh Trust as an assistant project officer. My working area is non-communicable disease, NCD control, and tobacco control. So it's pleasure to me to share share with all of you that recently I have promoted as project officer. So today I'm going to uh, present about a specific methods. It calls IOR. So it's basically we are using this methods in tobacco control. So it has been implemented in field data collection and mobilization of tobacco control law enforcement activities, especially the tabs ban provision according to the Tobacco Control Law 2005. So I'm so thankful to conference organizer as well as Mr. Habibur Rahman sir. My heartiest thanks to him to giving me chance for giving me chance to say something here
You will
in
start your
this platform.
presentation. Please start
Okay.
because you
So
will only get 10 minutes time. Okay.
okay, sir. Thank you. So my presentation topic already I mentioned IOR technique to implementation of TAFs ban. Uh, So, according to the Global Adult Tobacco Survey 2017, it's showing that in Bangladesh, 35.3% of total population, especially adult population, using tobacco products in various way. So, considering this, the health hazard of tobacco, Bangladesh government formulated the Smoking and Using Tobacco Products Control Act 2005, and it was amended in 2013. So it was found that the section 5 of the law, tobacco products, the law banned direct and indirect tobacco advertisement and promotions, all kind of promotions and advertisement. National Tobacco Control Cell, NTCC, continuing various effort to ensure effective enforcement of this law, but the tobacco industry, they are violating the law in various ways. They are targeting the younger generation to create long-term consumers. So what is the tobacco industry tactics? Here is some point. You can see the tobacco industry are advertising tobacco products by using brand color, their logo, company's logo, symbol, and sample packets, sticker, leaflet, and others materials. So point of sale is their main point to advertise tobacco products in public. They are decorating this point of sale, especially in front of school, in front of playgrounds and public places, to attract young people. So tobacco industry also attracting people, both shop owners and users, by giving them uh, gifts and other facilities. Tobacco industry also sponsor cultural and sports event as part of their corporate social responsibilities that direct or indirectly violation of tobacco control law. So the purpose or objective of this study was identifying gaps and challenges of the enforcement of tobacco control law that bans tobacco advertisement, promotions, and tobacco industry tactics. So we use various methods in these studies. So Bangladesh Anti-Tobacco Alliance is a platform, national platform that includes 700 anti-tobacco organizations. So the BATA, Bangladesh Anti-Tobacco Alliance, used map, monitor, and collection about tobacco industry activities regarding advertisement, promotion, and sponsorship So across the country, BATA members followed this method I called IR techniques. IR means identification, administrative and awareness, warning, enforcement, and reporting and results. So as part of the intervention, we organize various campaign meetings to sensitize shop owners to especially tobacco products who are selling tobacco products, and different stakeholders with highlighting tobacco control law that bans tabs, tobacco advertisement, promotion, and sponsorship. So what is the IR technique? Here you can see already I mentioned identification, administrative and awareness, warning, enforcement, reporting and results. This is our IR technique. So what we did in this study, so in the section of identification, we developed a tools that data collection forms. Here you can see the sample of the data collection form, and this is especially this is advertisement of tobacco products by the tobacco company, various tobacco companies. So administrative and awareness in this section, we advocate, we did advocacy with the local government organization, so that they issued, they circulated notice to the shop owners and to the related authorities. Also, we used various campaign about the tobacco control law, especially on to ban tobacco advertisement, promotion, and sponsorship. So here you can see the warning, the part of IR techniques. So we directly went to the shop owners to aware them about the tobacco control law. So here you can see the enforcement part. We cannot go for the implemented the tobacco control law. So we are going through the local government institution or who are related to implement this law. So you can see the executive magistrate and others related authorities, they ban tobacco products, elements, or what they are using to promote tobacco products. Reporting and results in this section, you can see that we organize one-to-one meeting with the local government authorities. Also, we handed over them to the related information and reports. Then they organize a meeting in their who are related to implemented this law. So in this result section, we found that tobacco industry is advertising tobacco products by using brand color, logo, symbol, sample packets of cigarette. Tobacco industry is setting up decorated point of sale to tobacco products in the public places, including in front of schools, playground, hospital, market, and to attract young people. Tobacco industry attracting youth people, both shop owners and users, by giving them gifts and others facilities. Tobacco industry also sponsor cultural and sports events as part of their corporate social responsibility activities. Once BATA member organization informed authorities about the violation of tobacco law, then authorities conducts mobile courts to remove illegal tobacco products advertisement and sponsorship. Conclusion, as all of you know that in Bangladesh, most of the people are younger. So to protect young youth people from initiation of smoking, implementation of tax ban, tobacco advertisement, promotion, and a sponsorship ban provision is important. For this purpose, IAR identification, awareness, warning, enforcement, and result and reporting is an effective technique that provides opportunity to increase awareness and warn people before enforcement. So here some recommendation. All of you know that tobacco is the gateway to start taking the drugs. So that advertisement of advertising of tobacco products attracts tobacco users. It is essential to take appropriate steps to stop all forms of tobacco advertising, promotion, and sponsorship to protect the health of the next generation. So here is some recommendation as all some people are know that government has circulated task force committee, district and upazila. So regularize the meeting of the tobacco control district and upazila task force committee meeting are essential. Ensuring proper enforcement of tobacco control law is needed. Conducting regular mobile courts according to the law and imposing fines as well as rigorous imprisonment and violators. Ensure central guidance, assistance, and accountability from the National Tobacco Control Cell for the activities of the officers, insers who are related to enforce the law.
Mr. Raihan, within 1 minute, you need to finish.
Okay, sir. Raise social awareness against tobacco use by involving public representative, administration, and politicians. Increase publicity at the national and local level about important provision of the Tobacco Control Act. So that's all from me. Thank you all. Thank you, sir.
Thanks. Thank you very much, Mr. Raihan, the Assistant Project Officer, Work for Better Bangladesh, for your presentation. Right now, I would like to welcome, actually, we are breaking already our serial. So is there anyone from Rakhil Khondokar or Mohammad Ariful Haq Sarkar or Salman Sohel or Mary Florence Freda? Is there anyone here?
Yes, I'm here.
Mohammad Ariful Haq. Yeah, Mohammad Ariful Haq. We are looking for you. You are going to present your paper on here. On which topic you would like to present your paper? Yeah, Mohammad Ariful Haq Sarkar, freelance researcher and social activist. And your topic is community leadership towards community mobility, a review. So you are welcome, and you have to finish your presentation within 10 minutes, please. And all of the participants, you are highly requested to mute your microphone during presentation. Thank you.
Thank you very much, all of you, especially moderator and the organizer. This is Mohammad Ariful Haq Sarkar. I am a social mentor and career mentor. I have an organization named Stay Well, Keep Well in Bangladesh, all over Bangladesh. I work with young people to develop their skill, and I have been working since more than 10 years in my local area, Jamalpur Sadar, to build up community leadership, community development. And I would like to thank WSWD 2021, 4th International Conference organizer, and to all of you. And I am so lucky to have invitation from you. Community leadership from the perspective of Bangladesh. I really feel community leadership is very important because we see all the almost of the political persons and almost of the political party, ruling party, they all the thing they do in central to Dhaka. It's all everything about Dhaka. That's why we feel small community leadership we should grow in our locality, our area, local area. That's why we arrange people. We arrange some same thinking people to arrange and to develop the society, to reform the society. Actually, I was out of Dhaka last lockdown in Bangladesh from today. That's why I did not have much preparation for the conference, but I actually try, and we want to set up a leadership, set up community development, like what we have, the power, the skill, the man. We should move with that. We should move with that to develop the society first, develop the local area first, then the central area, As a social worker, I am involved with involved with so many social work, social reform with political parties, political leaders, and I have to maintain many with many people of my local area every day. Their treatment, their many things I have to do as a social worker, as a real social worker. So I don't want to say anything else about that. I just want to say central, not like central leadership. Leadership should be decentralized. Leadership should be decentralized. Development should be decentralized from the nook and corner of the country. Then we'll have a better Bangladesh. We'll have a better society. We'll have a better country. Thank you very much. Thank you, Mr. Habibur Rahman, for inviting me. Thank you all.
Thank you, Mr. Presenter Ariful Haq. Though you are now in outside of Dhaka, but I think your personal experience reveals that yes, you are working with the community leaders and you are working with the political leaders as well to reduce this sort of problem. I mean, drug addiction and something like this. So you explained rightly, and we all are benefited by this discussion. All need not go through the slide and traditional presentation or something like this. Anybody can say, anybody can explain themselves like themselves accordingly, I think, in his own accord accordingly. So anyway, it's a nice presentation from Mr. Ariful Haq. He's the freelancer researcher and social activist. And right now,
thank you.
I am welcoming another one who is available here. Could you please raise your hands or just
here? Mr. Rakhil Khandokar is here, and I would like to give you some updates to changes in the roster. In our session guest panel, Mr. Mukhlesur Rahman is here. Great. In place of Mukul Jyoti Chakma, as he's in hospital. Professor Ali Waqas Shuhel, he is joining. Actually, it's registered before. He's joining soon. And Rakhil will present now. Mr. MD Salman Suhel, he has presentation at the afternoon. Now he's out. He actually requested us before. Rahan is over. Mary Florence Freda from India, she called me. As she's doctor, she is actually in duty serving the patient. So she just told me that I am trying to save someone's life if Almighty wants. So that is the real scenario. And Kanis Fatima, she's trying from Kumilla. Let's see. And last presenter, Elizabeth Alexandra. So I request you to listen to Rakhil, then Alexandra, and let's see how they can join us.
Okay. Thank you, Mr. Habib, for updating us and explain us the status of the presenter. So right now, yes, Mr. Rakhil Khandokar, can you listen? Am I audible to all, Mr. Rakhil?
Yes. Yeah. Thank you, sir.
You are welcome to present your paper. You are, I think, here the chairman, Dream Bangladesh Foundation, and your topic is drug addiction and role of youth in Bangladesh. This is very interesting, I think. So you are requested to start your presentation right now, and you have allocated also for 10 minutes. Please.
Thank you very much, sir, for giving me a chance to present my presentation. And thank you, Habibur Rahman sir, for chose me as a speaker in this plenary session. I'm very much interested to present my presentation in fourth international conference of WSD 2021 and organized by Community Social Work Practice and Development Foundation. I can share the presentation, share my screen.
Could you hear me? You can share your presentation.
Yes, sir. Sir, can you see my screen?
I cannot see your screen. No, we cannot see your screen. You try it again.
Now
Okay.
is it?
Yeah, it's okay right now. Yep.
Thank you very much, sir. My presentation name is Drug Addiction and Role of Youth in Bangladesh. I'm Rakil Khandekar, Chairman Dream Bangladesh Foundation, DBF. My presentation, here is my presentation overview. I presented those topics from my presentation. First of all, I want to tell about what is drug. A drug is something that affects your body. Drugs pass through the body and interferes with brain's nutrition. What is drug addiction? Drug addiction is a complex brain disease. It can cause serious long-term consequences, including problems with physical and mental health, relationship, employment, and the law. That is called drug addiction. That is the difference between drug and drug addiction. Available drugs in Bangladesh. There is many kinds of drugs available in Bangladesh. Some drugs are very much easy to catch. Here is there is some name of drugs which is very much easy to catch, as heroin, pethidine, gaja, yaba, etc. And nowadays, yaba is the most dangerous and available drugs in Bangladesh. Bangladeshi youth people are very much interested to take yaba, and that's why there are a lot of people damaged their brain, damaged their by youth by time by taking yaba. Why people use drug? There are many types of question we have heard last days. Uh, uh, why do people use drug? Everyone a question asks like this. So I think there is many types of reasons for people use drugs. Here is some information about why people use drug. Uh, some of them are inaccurate information about drug effects. They don't know what is the drug and what is the effects of drug, and what is the how drug is effects in our body. That's why very poor or very inadequate people or very much youth people are affected by drugs. Uh, they have inaccurate information, rejections. Sometimes for the rejections, they have taken drugs, pleasures. They think that if they taking drugs, if they take drugs, they can feel very much pleasure. That's why they take drugs, uh, fit in to escape or relax. For the relaxation, so they take this depression and stress. They think that if they take drugs, their depression and stress totally remove. Reduce pain. For the they use as the pethidine or so many other drugs to reduce pain. Here is another 5 cause of addiction. Here is 5 cause: chronic loss of control, compensation use despite negative consequence of drug cravings. Here is I see about the signs of drug abuse. Here is the physical warning: bloodshot eyes, pupils larger and smaller than the usual, changes in appetite of sleep patterns, sudden weight loss or weight gain, and so many things we see in physical warnings. There is another change in behavioral warnings. Uh, they don't work, poor work, decline in performance, financial problems, and so many things. Accident, travel prone, lack of motivation, and withdrawn, unexplained anxiety. Effects of drug use. There are so many effects in drug abuse, but there is some effects: loss of coordination, poor judgment, slow slow relapse, distort visions, memory loss, blackouts. Risk factors. There are some risks in taking drugs. Here is some risk factors I would like to show you. Your genesis, mental and health, family and social environment disturbance, effects on the brain. Here is the age-based statistics in Bangladesh. In government and private sectors, there are many kinds. There are lots of statistics, but in all the statistics we see that there are 7 million drug addicts in Bangladesh, and 65% of them are youth. 5 million of them are hooked on YAB pills. This is very, very dangerous things which has happened in Bangladesh, and we must stop it. Prevention and control. I have some idea about prevention and control to drug addictions. Avoid undue peer pressure. A child should not be pressed unduly to go beyond his or her capacities, be it studies, sports, etc. Education and counseling, organizing youth centers. Drug addiction may be caused due to the feelings of isolations, loneliness, anxiety, etc. Hence, social service organizations and NGOs should establish youth centers to overcome such feelings. Remedial measures, individual steps. I had some individual steps I would like to tell you. Send such addicts to a rehabilitation facility, humanistic from treatment. It said to be the most widely used and effects of all forms of treatment. Awareness and prevention must start at home with parents. This is the most important things I have seen. Uh, the role of the government, there is some role of the government. Government should uh, take necessary steps for the remove or for the control of drug abuse. The government can play a vital part in this regards, reduce the scale of unemployment. This is most important things. uh, there are some problems in our country. Uh, 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 30 to 70% of youth are unemployment. They don't have any job. They don't think how they work, uh, and there is no very much chance to become an entrepreneur because there because there are lots of money to use to make an entrepreneurship or to make a business. Government
Mr. Rakhil, could you please make short your presentation? You already
yes, sir. Yes, sir. Yes, sir. Already I have concluding my presentation. A strong punishment to the drug dealers. Here is my here is some treatment of for drug addiction. Here is the names of this. And now I am very much interested to tell about Dream Bangladesh, how Dream Bangladesh Foundation work against drugs. Uh, we work uh, we work be like that: awareness build up, campaign, quiz competition, documentary making, short film making and competition, seminar, motivational program, counseling, free treatment. Here are some pictures of our work.
yes. Yeah, so I think
Yeah, it's just 1 minute, sir.
yeah.
And now I am come to my conclusion part. Drug abuse is a complex problem through the results from a combination of psychological and environmental factors, and that's why we should take a necessary steps to overcome this problem. And youth are must be very much aware of this problem, and our parents and also government and also our society, society people and society are very much important to take this role to overcome from the drug abuse. And thank you, sir, for giving me chance to present my presentation. And I think this is very poor presentation from me. I just want to see the problems and some of regions, and I have some uh, uh, uh,
No, thank you very much,
questions.
Mr. Rakhil Khondokar, for your nice presentation. Though you say it is a poor presentation, no, it's very resourceful information that you have presented. You explained 5 causes and you explained behavioral and mental changes as well. At the same time, environmental context and psychological context, you explained many things you have just brought here in your presentation. So thank you very much. and wish you best of luck. Right now, I would like to welcome our another presenter, Mr. Salman Suhail. Are you here, Mr. Salman? Salman Suhail or Mary Freda? Are you here? Okay, then I can go directly to the Alexander. Alexander, can you listen me, Elizabeth Alexander? Please unmute your
Yes, sir,
microphone.
I can hear you.
Yeah, Alexander, I'm requesting you to present your paper, and I think it must be enjoyable for all. So you are welcome, and you need to take care of your time. At the same time, I'm requesting all of you, the participants, to mute your microphone during presentation. Thank you. Thank you, Alexander. You are welcome to present your paper. You are the assistant professor and head, Department of Social Work, KE College, Mananam, Kerala, India. So she's from India, Elizabeth Alexander. We are waiting to watch your presentation.
Okay. Thank you so much, sir, for giving me this wonderful opportunity, and also appreciating the efforts of Habibur Rahman, sir, for bringing people all around the world to this platform.
Yeah.
So good morning, all the participants and the chair. Now I would like to share with you how the pandemic situation, COVID-19 situation, affected the normal life of children. Sir, am I audible? Is it clear?
Yeah. You are clearly audible. No problem. You go on.
This is a study completely based on secondary data, and the research have the objectives to analyze various problems faced by children due to this COVID-19 pandemic, or the impact of COVID-19 pandemic on our children. So in any crisis situation, be it war, natural disasters, or pandemic, children, especially those who belong to socioeconomically backward and marginalized communities, end up becoming the most vulnerable demographic. So the COVID-19 pandemic has multifaceted impacts on children, that is psychological, mental, physical, social, and cultural. So 41% of India's population is less than 18 years of age, and their mental health issues cannot be neglected during the pandemic and post-pandemic time. So these effects are not limited to health and well-being, but extended to many dimensions of children's lives, their education, safety. So this is the data which I got from UNICEF's report. And moreover, the harmful effects of this pandemic will not be distributed equally. So they are expected to be most damaging for children in the poorest countries and in the poorest neighborhoods, and for those in already disadvantaged or vulnerable situations. So here I am sharing some common problems children faced universally. So the first problem which I identified by referring the falling into poverty. So as estimated, 42 to 66 million children could fall into extreme poverty as a result of the crisis this year. So adding to the estimated 386 million children already in extreme poverty in 2019. So this pandemic situation brings this much amount of children again to poverty. So in Kerala, the government provides some food kits to people through local distribution system to avoid the situation of extreme poverty. And the second problem is the learning crisis. As we all know, about 188 countries have imposed countrywide school closures, so affecting more than 1.5 million children and youth. The potential losses that may occur in learning for today's young generation and for the development of their human capital are hard to fathom. So more than 2/3 of countries have introduced national distance learning platforms, but among low-income countries, the share is only 30%. So before this crisis, almost 1/3 of the world's young people were already digitally excluded. So, but in Kerala, the learning situation or the learning system completely shifted to online platform, and the education department took special attention to each students. And the third problem which I identified is threats to child survival and health. So economic hardship experienced by families as a result of the global economic downturn could result in hundreds of thousands of additional child deaths into 2020. So reversing the last 2 to 3 years of progress in reducing infant mortality within a single year. So, and this alarming figure does not even take into account services disrupted due to the crisis. It only reflects the current relationship between economies and mortality. So, it's likely an underestimate of the impact. So, rising malnutrition is expected as 368.5 million children across 143 countries who normally rely on the school meals for a reliable source of daily nutrition must now look to other sources. So the risk to child mental health and well-being are also considerable. So refugees and internally displaced children as well as those living in detention and situations of active conflict are especially vulnerable. So the next problem is risk for child safety. So lockdowns and shelter-in-place measures come with heightened risk of children witnessing or suffering violence and abuse. So children in conflict as well as those living in unsanitary and crowded conditions such as refugees are also at considerable risk. So children's reliance on online platforms for distance learning has also increased risk of exposures to inappropriate content and online predators. From local and national level dailies, it is evident that the abuse cases increased during this COVID-19 pandemic time. So children are facing more abuses from their family itself. So, and the next problem is mental and psychological well-being of the children. So, staying within the four walls of their houses affected the mental health of children negatively. So, the lack of proper social life, physical activities, and physical engagements, etc. So, it clearly evident from secondary sources that there is a steady increase in the number of suicides among children due to stress-related issues. So these are the major problems I identified, which is related to children during this pandemic time. So while checking the situation in India, we can see the novel COVID pandemic where children, they have been reported of children below 12 years of age became infected in India through compared to other age groups far fewer and affected. So acting upon these concerns, some agencies and professionals have come forward in different countries to provide counseling and psychosocial support services for children and young people, but it is running not at all an effective manner. So due to lockdown, many children have had no physical access to friends, peers, schoolmates, and relatives for more than 6 to 8 months. So limited or no opportunity for outdoor play and socialization may also impact children adversely, making them easily bored, angry, and frustrated. So although many are active on mobile phones and virtually connected, there is high probability that they will become increasingly engrossed in social media and online entertainment. So there have been reports in India media of problems such as overuse of mobile phones can, lead them to severe health issues. So increased digital connections can also result in emotional contagion and where the distress and fear experienced by one spread to another person. So children who have lost one or both parents due to pandemic are obviously highly vulnerable during this situation. So, and the quarantine and isolation and traumatic situations also lead the children to more stress disorders. And adversities affecting children may be divided into 3 categories. And the first category is those who are COVID-19, COVID positive patients and are isolated. And the second category is children of COVID positive parents. And third category is children who have lost either or both parents due to the infection. So children who are in quarantine or isolated due to general lockdown also considered under this category. So children in different categories may face different sets of mental health issues too. So in such scenario, mental health services providers, parents, and immediate caregivers have a major responsibility to help children in distress. So for parents, it is essential to create a sense of normalcy at home by planning a package which should include play, academic activities, interaction with family members, creative writing, socialization through phone, video calls to friends and relatives. And the Indian Association for Children and Adolescent Mental Health also suggests that children need reassurance that this time will pass. So it is important for parents and caregivers to be calm and proactive, letting the child feel the emotions, check in with them about what they are hearing and doing, and by monitoring their own and their children's behavior. So the psychological problems identified in such children range from mood to conduct disorders, substance abuse, anxiety disorders, and suicide tendencies. The development of an emotional epidemic curve to understand the mental health epidemiology of the pandemic is the need of the hour. So here I included some suggestions also. So the first suggestion is to prioritize the continuity of child-centered services with a particular focus on equity of access, particularly in relation to schooling, nutrition programs, immunization, and other maternal and newborn care and community-based child protection programs. So that is the need of this time. And provide practical supports to parents and caregivers, including how to talk about the pandemic with children, how to manage their own mental health and the mental health of the children, and tools to help support their children's learning. And for each of the above, specific protections must be put in place for vulnerable children, including refugees, the displaced, the homeless children, the migrants, minorities, slum dwellers, and also children living with the disabilities. And street children are living in refugee settlements. So, and institutions, especially children in institutions. So now is the time to set up international solidarity for children and humanity, and to lay the foundations for a deeper transformation of the way we nurture and invest in our world's youngest generation. Thank you all.
Excellent, excellent, Alexander. Thank you very much for your informative, very, very informative presentation. And of course, we all here benefited by your presentation because you rightly narrated all the things, how our children becomes, I think, traumatized during this COVID-19, and how they can be protected from this type of problem. Yes, you study. I think it would be better if the organizer published their proceedings, and your publication must be there. I think then we all will be benefited, as you did not give any presentation, any slide presentation. So I think if we just get your literary version, then I think people will be benefited. So my request is to the organizer to publish the proceedings, including all of your articles. So thank you very much. Thanks. Right now, I would like to welcome, I think this will be our number 6th presentation out of 10. So I would like to welcome anyone who is available here. Is there anyone, please, who are our enlisted speaker? Please, is there anyone still pending? Salman Sohel, and then Lutfur Rahman Manik, and then Razaul Korim. Mr. Habib, Mr. Habib, are you there?
Yeah, Honorable Session Chair.
Yeah.
Just immediately I talked to Mr. Salman.
Yeah.
You know, yesterday there was stormy weather, and one from Sylhet, they reported me they cannot join because of network. There is a big problem, so it's natural issue. And as none of the participants are here, we can directly go to our honorable discussant, Mr. Mukesh Rahman.
Yeah.
If you
that's good. Yeah, I think so. We can concise our session. I think up to 1 o'clock it should be continued. But as 3-4 presenters is not available here, so we are directly go through to our ex-secretary in Government of Bangladesh, Mr. Mokhlesul Rahman. Please, if you are available here, I have seen you here, so I will be very pleased if you come and just discuss about today's topic. Mr. Mokhlesul Rahman, the former secretary, Bangladesh government. You are welcome.
So I am here. Can you hear me?
Yeah, you are clearly audible to all of us.
Thank you, sir, for your well chairmanship and very conversant in the good morning in the COVID. We are enjoying the sessions and the papers. I have gone through, to be frank, 4 or 5 papers. Number 1, Mary Grace, relaxed issue. Actually, I'm also involved in this kind of relaxed issue of Director of Narcotics, Ministry of Home Affairs. It's completely relaxed issue. We have selected 423 centers where the people who are going for relapse first time, second time, third time, fourth time, even 5th times. This is the study. So we'll talk about later on. And Nasir and Mr. Abu Raihan is from Jamalpur. He has also, this is also a drag issue regarding sugar, cigarette, and so many things. And Muhammad Arif Sarkar, and the last one is Elizabeth Alexander from India. I think, am I visible?
Yeah.
That's okay. So it percent about the issues, and Indian issues and Bangladesh issues are most of the countries are different, by and large same. It more on Mary Grace Monica relapse issue happening in our country. By and large, government recognized. So these peoples are somehow or other, how they are going for first time, second time, third time relapse. So there are some, we have, this is correlated. Drug addicted participants, rehabilitated centers, especially the relapse, our the number 423 participants to know the real issues. We have selected 4 divisions. We have 8 divisions, 10 participants to 80, and knowledgeable persons related to these drug and drug cases, mental health, and so many issues. So we have selected 4 from each division. So 32 persons will be in a 8 conference. At Rehabilitation Center, we have selected 70. We have more than 400 rehabilitation centers, but recognized, authorized, and according to the standard of this service, we have selected from the Ministry of Home and Director of Narcotics. This list we have finalized. So 70, and relapse patients and another their family. Family is very important because how this case is happening, and for this case, we have taken 8 case study. I like to say 2-3 case study. From Bangladeshi, all people know one highly educated from Oxford, and he was a banker in HSBC, highly paid. He was so addicted in Gulshan area, they have their own residence. He killed his father and assaulted his mother. And after that situation, his mother said, "Don't bring me in the hospital, bring me in the jail so that I can save my life." This is the outcome of the relapse case of the drug. And another one case is a Oishi. Everybody knows that in very near to my residence, Mokbazar, his father was police inspector. And only one, she ultimately murdered her parents. So we have to go through why relapse happening. In Oishi case, we have seen in the media and everywhere that Oishi was taken 50,000 or 25,000 or 1 lakh pocket money from his father. His father's income is less than 50,000 taka. So where from this money is coming? So the daughter of that inspector is awareing that his father is not in good shape. He is earning from black money. So she dragged in such a way, she ultimately blackmailed to her parents. So there are so many these kind of cases. So we have taken 8 cases, high gravity. Relapse is happening also in the poor section of people. So we don't know where money is coming. But if somebody wish that he will take drug in so many ways, and this you cannot check. So abuse normally in our question set we have second. Now we are getting one kind of very expensive view. The what is called ice, 5 crore taka per kg, and there are so many common drugs in our country. These drug is so available, and the what is called the root cause of the drug is within their reach. even sometime within the mohalla, amra Bangla, we call in Bangla mohalla, that means within your village, you can take certain time. Pardon? Well, can you hear me?
Yeah, we can listen to you, but I'm requesting somebody to mute your microphone as our discussant is discussing. Please, Mr. Mukhlis Rahman, you proceed.
Because I'm talking about a drag more because the papers which have been already presented, 4 or 5 papers, most of the cases are related to the drag. Number one is Mary Grace Marika, specific, directly related to relapse drag. And another one, Mr. Abu Rahan, he has also drawn his paper on the tobacco.
Yes.
And the Elizabeth Alexander from India, she also talked about our infants and the baby issues which are correlated with this kind of things. Virtually, she was talking about family issue. Virtually, the drug abuse gets support and get support to get rid out of it. It is from family. Family can protect. Otherwise, no one cannot relapse, stop relapse. First time, second time, our most common supplier and most common co-partner is friend. So selection of friend is very important. Selection of friend regarding this kind of issue. So Professor Nasir, you have given me time, and you are also the dean and the very academic position. It's a very prestigious position regarding next to Vice Chancellor. So, and your smiling face, I'm enjoying in the morning. So talking about this issue, we can talk long, but I know that there is a lot of people are talking, and they will be talking on the issue. So if I say less, it is better. And thank you very much again, Professor Habib, who is the, I can say, unique and only one initiator who has this morally high, so that he can continue this 4 days international conference in this COVID situation. I really appreciate he and his team and his organization. With these few words, thank you, sir.
Thank you, Mukhlis Rahman, Secretary, Bangladesh government. Excellent, and you have given some live example that happened in our country, Bangladesh, and how they have distracted, how they have just destroyed their own life, at the same time their parents' life as well, and the society as well, I think. So it's a good learning to us, and you have mentioned your comments on the presenters presented today, the papers. So this is very nice, and we need to follow your advice. And of course, it's an example, and we are really happy that you have joined with us. And right now, I think we are at the very near to our concluding session. So I don't know, Mr. Habib, is Mukul Joyati Chakma is here?
No, he's not here, but as discussant of the session, Dr. Poonam Gularia, she is here from Tata Institute of Social Science, Mumbai. Dr. Poonam Gularia, can you hear us? Poonam?
Yes, I can hear you. I was attending the session in the morning.
All right, that's great. She is the discussant of this. So, honorable discussant, Dr. Poonam Gularia, on behalf of session chair, actually, I'd request session chair to invite her to have a discussion on it.
Okay, you will invite it, and of course, we will be resourceful by Dr. Poonam chair's discussion. So you are welcome, Dr. Poonam chair from Mumbai, to discuss your issues based on the today's topics and today's agenda. I think you have heard this. So you will start, please.
Thank you, Professor Mithun, Dean, National University of Bangladesh. As just stated by Mr. Mukhlis Rahman, the ex-secretary, you were really very pleasant in conducting the session, and we did not find the heaviness which we generally find when presenters are presenting, because you were weaving in your humor and your lightheartedness. We are grateful to you. Also grateful to Mr. Mukhlis Rahman, because it was an eye-opener that he has mentioned the study that is being undertaken by the Ministry of Home Affairs. Maybe for all of you in Bangladesh, you are aware of more intricacies of mishaps in terms of relapse happening in this sector of drug addictions in its different ways. But yes, hearing it here is quite painful, and we pray that there are other mechanisms which bring peace and solace to the families. We had five speakers this morning. I'll be brief because you have already touched upon feedback from them. Mary Grace from Philippines highlighted relapse and rehabilitation processes. Yes, discussed family therapy issues and coping mechanisms. Followed by Muhammad Abu Rahul, Assistant Project Officer, Work for Better Bangladesh. That was also quite detailed, and we learned about IAWER and TAPS, the techniques that he has mentioned, and a detailed case study for us to work further with in different fora. Because as Mr. Habibur knows that I coordinate the first year fieldwork program and I oversee the students' fieldwork placements. So I would like to connect subsequently with the NGO sector and the communities. And these are important learnings for me personally and professionally to share with the people I work with. Thirdly, Mohammed Aruful Hok Sarkar, social activist, as said to us by Chair, community leadership towards community mobility. He has also a career mentor, Stay Well, Keep Well, very apt title of his organization, and we learned about working towards community development. This was followed by Rakhil Khan, who spoke on drug addiction and role of youth in Bangladesh, the chairman of Dream Bangladesh Foundation, 5 Cs, 5 million people on pills, and various inputs on behavior change, on effects of drug abuse. Very resourceful presentation. The last detailed presentation was by Elizabeth Alexander, assistant professor. Although it was based on secondary data, a lot of very valuable inputs on the role of families and social support system required for children. I thank the organizers, Professor Habibur Rahman, the chair, the dean, Mr. Mokhlis Rahman, the ex-secretary, for giving me this opportunity to share my views. Thank you so much and all the best.
Thank you. Thank you. Habib, is there anyone? If not, then we can go to the concluding session, I think. So
No, Honorable Chair, as per roster, actually no more participant, but I cannot allure myself to get some words from you because I should introduce you. Normally session chair normally has nothing to speak more, but as we have time enough, we are very fortunate. Ladies and gentlemen, let me introduce Honorable Session Chair, Professor Dr. Nasiruddin Mithul. He is ex-professor of Russia, very renowned university, Russia University of Bangladesh, and currently that actually Mr. Mokhlis mentioned next to VC, he is a senior dean in National University of Bangladesh, and so far I could read during this pandemic, he is a very, very vibrant academic scholar in Bangladesh. More than 30 write-up he has produced in different journals and newspapers, concentrating to the youth class, good parenting, youth motivation, info, so many things actually he has produced this time. And Professor Dr. Nasiruddin Mithul has indexed more than 78 publications in different journals. So I definitely, being organizer and the session organizer, I definitely cannot control myself to invite honorable session chair not to only concentrate on the papers already discussed by presenters and discussed by, supplemented by Mr. Mokhlis, Honorable Ex-Secretary, and Dr. Poonam Gulalia. So I request you to take additional 10 to 15 minutes, Honorable Session Chair, to produce something and just keep us vibrant as you, how you can really keep smiling during this pandemic, and that's all. Thank you.
thank you, Mr. Habib. You said exaggeration words on me, I think, because session chair has nothing to do except appointing the chair, but you have given me the floor. Mokhlis sir already mentioned that, yes, always I'm smiling, and I think from Poonam, Mumbai, she also mentioned, it is possible, I think, you would like to finish your program just with my speech. I think up to 10 to 15 minutes means it will automatically fill up the gap up to 2 o'clock. I could understand. I could realize the thing. So anyway, I am not expert on this subject. I'm not a person from social work or from sociology, but you know, as a professor in information science and lab management, I have some courses. And during this pandemic, how I am smiling, you know, it's a very good question to me, because sometimes my teenage daughter asked me this question, Papa, why you are laughing every time? People are dying, etc. And I will also request to everybody that yes, laughing, smiling will boost up you to increase your immunity. So please don't forget to laugh. Don't forget to smile. It is one of the most important weapons in our life, everyday life. So it will only help me. So what will happen? You see the yesterday scenario, Prime Minister was speaking in the parliament. During then, after her announcement, after her speech, she could learn about that Aslamul Haq MP died, who was just joined the parliament day before yesterday. This is the life, you see. So Prime Minister was thundered to listen this sort of news, and he was cried. She was crying in the parliament. So this is the scenario. This is the life. Aslamul Haq MP, he was present day before yesterday in the parliament session. Yesterday, he died because of cardiac arrest. This is the life. So we have come just for a while. It is true. But this session, I think, as I am working on, especially in the information sector, so I have to collect, I have to organize, I have to disseminate, and I have to preserve all sorts of information regarding every disciplines. I'm not claiming myself as a multidisciplinary person, but I have to collect, I have to organize this information for my own updated and for the updated of the people as well, the community people as well. So today's session, Mr. Habib, you rightly mentioned that, yes, this is the burning issue, even in the COVID-19, that since day February yesterday, you have started this conference, and from up to tomorrow, it will be continued. And more than 100 papers here presented. And what papers today the presenters presented, it's very, very effective to all of us. What we should do, and we need to discuss something about the depression, anxiety, and stress that we call DAS. This is very important because right during COVID-19, when pandemic occurs, it does not come alone. We need to remember it very carefully. When pandemic occurs, it never comes alone. Simultaneously, it brings infodemic, it brings ecodemic as well. So infodemic means, you see, some of our presenter mentioned here that yes, improper information is one of the responsible causes to increase the drug addiction. This is true because if you see the starting of the pandemic, thousands of misinformation, wrong information, fake information, disinformation occurring everywhere. And what is true or what is lie, people become very much confused to take the right thing. Thousands of information slantedly comes, I mean, that we call gujab, that we call speculation. So pandemic brings together the infodemic, at the same time epidemic, the supply chain broken. You see today, from today, lockdown started. So the supply chain will be collapsed in some areas, and our lifestyle will be little bit changes. And we are already mentally prepared because our early year, our last year experience will help us to go through the right way, I think. And the situation of pandemic is still increasing gradually day by day, especially in Bangladesh and India and some other areas. So we have experienced how to face this pandemic because we have reduced it in such a way that have been appreciated by the world. Even you see the 3 months before the statistics reveals that yes, we were completely successful to control the pandemic. Right now, we strongly believe we should not lose our immunity thinking it that we are going to fail or something like this. No, this is the intention of the people. This is the can-do attitude of the people. People have that can-do attitude. Yes, we already occurred. We already created the can-do attitude among our community people that yes, we can. If we desire, yes, we can to reduce this. But government should give some policy sometimes. That's why we need to follow it. But this time, I think many things happen because when pandemic comes, it brings infodemic, it brings economic. Even our children, you see, children are not going to school since long. Our university students, they are suffering a lot in their academic frustration from the very beginning of the pandemic, because frequently declaration of closing the school, college, and university, they are they have been undecided. You know, they could not take the decision because the schedule have been broken. Some students, I mean, especially we need to consider the age level. There is a different age level students. We have our primary, I mean the kindergarten students, our primary students, our school students, our college students, our university students. If we treated all of them as a student, categorically they are suffering a lot during this. And what we will do? This is a very common question. Each morning, my daughter asks me, Papa, what is the routine today? What I will do today? So every day, I think thousands of parents are listening this type of questions from their teenage daughter, from their teenage son, or something like this. This is very common question, but we need to handle it very carefully. And I think today, I personally learned many things from the presenter's presentation. I personally learned many things because this is, I have seen that a lot of experts here from various disciplines. Somebody here worked as a Dream Bangladesh, somebody works in as a freelancer. They have shared their experience. Of course, I will apply it to my family members to cheer up them. But you know, the scenario is really very vulnerable in the country because drug addiction, academic frustration is happening everywhere. So what we should do? And many people have explained the causes, why it's happening. Why it's happening. In the quarantine time, government declaration of the frequent school, college shutdown, quarantine period, lockdown period, all the things, all the time. I mean, we have to change our mind. We have to change our schedule. We have to change our work plan. Say, for example, why I'm thinking that my child became traumatized during this session. I myself became traumatized as well because today I was eagerly waiting for going to office, my office. But you see, since 8 or 9 months, we are not going to office because we are the teacher, our school, college, university is closed. But we are working from the home. Every single hour, we are working from the home. But right now, it's a question, you know. Online class, is it the replica of the face-to-face class? People are asking us these common questions. Never. It may be the supplementary or complementary of this situation during this situation, but it may never change the place of the face-to-face class because right now we feel bored. It was because when it was quite new during the beginning of the pandemic, we were very adventurous. We were feeling very thrilling. We were just readjusted our pedagogy. We were readjusted our syllabus, etc. Then it was very adventurous to us. But right now, the work is also boring to us. So what we should do? And not only difference is like that, face-to-face class is face-to-face class. We are missing the chemistry of our students. We are missing the chemistry of the eye contact of our student. This is the scenario. And even in the exam system, we could not launch a good exam system that will be recognized all over the country. That is the problem. That's why session jam is occurring. Session jam, not only in Bangladesh, it's a global scenario. So face-to-face class is face-to-face class. It may not be the replica of the online classes. This is the common thing. But we have to wait. We should not lose our patience right now. And I'm just requesting all of our students, you know, when I am entering into my class, I'm requesting all of my students to be cheer up. Just to be cheer up, to keep your immunity up, because they are right now suffering a lot for poor sleeping, you know, because up to midnight they are browsing online. They're staying over there since long. And they are not doing an exercise because you in your presentation you have also mentioned that they have reduced their exercise as well. And continuous browsing internet, it has a negative impact a lot, severely negative impact a lot. Because we, as a father, I don't know how many people in our community have just know the history of the internet. Because what they are browsing, what my kids browsing, If we don't know what he or she has browsed, it will create a big vulnerability. We need to monitor it, what they are doing, shutting down the door, staying in the room, what they are doing. Of course, we need to monitor it. But I think the scenario may be continued. The situation may be continued since long, we don't know. But we don't have to lose our patience. I am in our online class, we are requesting all of our students right now that yes, give a new assignment, give a new assignment, and you have to present your paper. Why I will present your paper and you will be the audience. Right now, I will be the audience, you will present your paper. It will at least make them some, I think, vibrant. Just make them vibrant. This is the way. So I think during this pandemic, you already have identified the problems, the anxiety, stress, especially depression, anxiety, and stress. And in our country, a recent survey says, yes, there are 4 categories. I mean, they have identified. One is mild symptoms. Another one is moderate symptoms. Another one is severe symptoms and very severe symptoms. So the statistics reveals a very dangerous thing, especially for the university students. They are going to take new drugs, new drugs, because supply chain is blocked right now. Blocked. So from India, from Myanmar, we are not receiving anything. Say, for example, due to in black market, it will be happen, but the formal way, drugs are supplying little bit. I think supply chain has broken, but country, what we have seen, we see that people, they are using new substances as a drug, new substances as a drug. This is very dangerous for public health, very dangerous for student health, that we need to be careful from it, seriously. So this sort of, conference, especially for this period, pandemic period, Mr. Habib, I would like to mention your name specially because this today lockdown started. So your conference is within this lockdown would be very much fruitful, because if you see, even the office or something like a shop or market started, then our participants will be a little bit lower, I think. So you see, the people who have joined here, I think intentionally they have joined, prepared for taking preparation, they have joined here. Because participants, I can see here, and as you are broadcasting a live program, so a lot of participants are watching this program at the same time. And I think all people will be benefited. So I am I will not continue my speech because of time constraint. I know you have another session at 2 o'clock, and many sessions still you have pending. Mr. Habib, this sort of title, this sort of presentation today, we are really benefited by listening all of this presentation. I am giving thanks to all of the presenters, especially our Grace, especially from Philippines and from Bangladesh, Raihan, and Rakhil Khondokar, Elizabeth Alexander from India. So all of the presenters, they have rightly mentioned many information that will help us to keep ourselves, free from drug, free from danger, and help us to keep smiling ourselves. So I am giving thanks to all of the presenters. At the same time, we need not to be frustrated. Please have patience, and we need to pray. We need to stay besides our affected people, or I think the children, or even our family members as well. And we also need to maintain unsocially the social distance. That is the real causes. We need to maintain the unsocially the social distance. I have heard that yes, social distance also is one of the causes to take the drugs. Of course, I believe it, because our university students, they are very much fond of to talk each other face to face. They are fond of to share many things among themselves. when they meet together. But unfortunately, they are not doing this. That is also, I mean, loneliness, creating loneliness is one of the major causes of taking drugs or something like this. So we need to be careful, because pandemic, when it will occur, how it will occur, and if we see the history, of course, every after 100 years it comes, and automatically, I mean, as our science and technology has developed a lot, of course we will win. You see, within 10, 12 years, no vaccine will come in the market, if you see the history of the last century. But within this time, within 11 months, we got a vaccine. This is the magical scenario of the development of our science and technology. So science and technology is working a lot on it. So we should not be frustrated at all, but we need to keep patience. We need to maintain all of the health tips that has come from our government. And of course, we need to be careful until that school, college reopening, and everything will be normal. My guests, my discussion, my speakers, and all of the presenters, thank you very much. May Almighty Allah keep all of us well, keep all of us healthy. And we are also praying for the affected people who are already affected. We also pray to Almighty Allah for their immediate recovery. At the same time, we also need to be very careful about our family, about our society, about our community, and about our students as well. Thank you very much. See you, everybody. And that's all from my side. Thanks. Thanks again.
Thank you, Honorable Session Chair, for wonderful discussion. And all the discussions I was amazingly listening to, like the young champ, Mr. Rakhil Khandekar is here. Actually, he's a very, very young, energetic, and dynamic activist, social activist. Rakhil is working. Mr. Ariful Haq Sarkar was delivering his life experiences very, very nicely. Mary Grace, actually Mary Grace from Philippines, she's very close friend of mine. She was wonderfully discussed a topic. Abu Raihan, excellent discussion. And Elizabeth Alexandra, she's my friend from India, and she is a social work leader there. And lastly, of course, I should say they are our mentor, Dr. Poonam Gulalia, and of course, ex-secretary, Mr. Mokhles. If someone asks me whom you love to be, like, I should say a young and energized person like Mr. Mokhles. After having retired, he is very dashing, very smart. I shouldn't say like this, but I'm just sharing, because sharing is caring, you know. That's why I'm just telling I should be. And last of all, Honorable Session Chair, and I couldn't control myself to have some words from Honorable Session Chair. So again, I just convey my profound respect and regards to all of you. Let me share our today's program schedule. You know, I just think life should be just like a test match, not a one-day match. Then you might be tired. That's why we started just like a test match for the international conference, and continuously we have been hosting this, and we're just getting some energies. We are being energized in that way that actually Honorable Session Chair told us. Then that is stay safe, stay connected, keeping social distancing, which is very important. And we are just following this. We are in this stand, just confined in 2 rooms. We are operating this system and hosting this conference, but keeping connected to this Zoom platform due to the good side of COVID-19. And today, I love to share you our today's next session schedule. Today, just at 3 p.m., there will be 2 sessions together, 2 parallel sessions. Start sharp at 3 p.m. Bangladesh time. Session chair, technical session 9 will be chaired by Dr. Mahfuzul Haq, Pharma Secretary, and Rashid Ahmed will be co-chair, and guest speaker will be Dr. A.H.M. Mahbub Rahman, Head of Social Work, Bangomata Sheikh Fazilatunisa Mujib Science and Technology University. And there are so many scholars from different parts of the world who will join and deliver on that topic. Topic will be response of CSR to community transformation and social economics solidarity. That would be the topic at 3 p.m. And another session, technical session 10, will be chaired by Professor Dr. Ashok Kumar Sarkar from Vishwa Bharati, West Bengal, India. And the topic will be child and adolescent care, good parenting and social work intervention. There will be also speaker from at least 7 or 8 countries. So hope you will join there. And third session of today, technical session 11, this is separately, specially designed on autism and care. Three speakers, Dr. Tiffany Neal from USA. She is the assistant director of Hands in Autism, USA. Mr. Toby Mountjoy from Hong Kong, she will join just at 5:30 p.m. sharp Bangladesh time, and Dr. Hena, she's from India, she will join, and the session will be chaired by Professor Salma Akhtar. And session guest will be Dr. Anwar Hussain, and a special guest I would already requested to Professor Dr. Nasiruddin Mitul, if he has time enough on that session today, just sharp at 5:30. And tomorrow we have again session in the morning sharp at 9 a.m. tomorrow, a special session on counseling, behavioral therapy and stress recovery. 5 speakers joining from total 6 different countries. Professor Johura Tanjima will join from Russia University. Professor Nasiruddin Mitul will, again, I request him because this session actually he enjoys most and I'd love to get some voice from him. Special guest of the session, Richard from Australia, and the session speaker, Jessica Stone from America, Catherine from America, Wilkins Ness from Kenya, Matt Strain from USA, Tarak Cottrell from USA. Actually, this session designed from these 2 continents, especially for their time convenience, and they are from different countries with the same time zone. So thank you all, thank you, and hope to see you again. So honorable session chair, you can just conclude the session right now. Thank you.
Thank you very much. Thank you very much all. See you there. Yes. Assalamu alaikum.
Assalamu alaikum.
Thank you. Thank you.
Thank you.
Thank you.
So Habib, can you centrally close the session? Mukhlis sir,